Can imaging show if CF modulators are working? Can imaging techniques help us understand if cystic fibrosis modulators are effective? The answer is yes, but let's explore how and why. Imaging plays an essential role in monitoring lung health in individuals with cystic fibrosis. The most common imaging methods include chest X-rays, computed tomography scans, and magnetic resonance imaging. Each of these techniques has its own strengths and limitations, particularly when it comes to resolution and the ability to detect changes in lung structure and function. Magnetic resonance imaging is particularly exciting because it allows for detailed visualization of lung structure and function without exposing patients to ionizing radiation. This is especially beneficial for those who need regular assessments, like patients on modulator therapies. Recent advancements in MRI technology, such as three-dimensional ultrashort echo time imaging, enable doctors to see local ventilation issues and changes in the bronchial walls. Studies have shown that patients treated with cystic fibrosis transmembrane conductance regulator modulators often exhibit improvements in their MRI scores, indicating positive changes in lung health. On the other hand, chest-computed tomography is considered the gold standard for identifying structural changes like bronchiectasis. Low-dose CT scans have been developed to minimize radiation exposure while still providing high-quality images. These scans can detect early lung abnormalities and help monitor how well patients respond to treatment, including the use of cystic fibrosis modulators. However, it is important to note that repeated CT scans can pose a risk due to cumulative radiation exposure, particularly in younger patients. Imaging results are often used alongside other clinical measures, such as lung function tests and biomarkers, to provide a comprehensive view of a patient's health. For example, improvements in MRI scores can correlate with better lung clearance index results, which measures how effectively air moves in and out of the lungs. This means that while imaging can reveal structural changes, it is also essential to consider other tests to get a complete picture of lung health. However, there are limitations to consider. Changes in lung structure may take time to show up after starting treatment, and different imaging techniques can vary in their sensitivity to reversible versus irreversible changes in the lungs. Ongoing research is focused on refining these imaging methods to better validate their effectiveness as indicators of treatment response. In practice, healthcare providers may use MRI or low-dose CT scans periodically to track lung health in patients receiving modulator therapy. These imaging findings are integrated with clinical symptoms and other tests to guide treatment decisions. MRI is becoming increasingly favored for long-term monitoring due to its safety and ability to detect subtle changes in lung function. In summary, imaging can indeed show if cystic fibrosis modulators are working by revealing improvements or stabilization in lung structure and function. MRI, in particular, offers a safe and effective way to monitor these changes over time, complementing other clinical assessments in the care of individuals with cystic fibrosis. Always consult healthcare professionals for personalized medical advice tailored to individual needs.